The article aims to evaluate the impact of balance impairing and cognitive dysfunction in patients under 65 years of the which chronic obstructive pulmonary disease, comparing them with healthy individuals and analyzing related clinical factors such and the severity of dyspnea, oxygen saturation, the number of hospitalizations and depression. Further, it seeks to highlight the relations between balance and cognitive functions, highlights how these impairments impact the quality of life and functional capacity of patients. It also emphasizes the importance of performing preventive tests from the early stage of the disease and designing personalized rehabilitation strategies to prevent the progressive of functional loss. The article proposes incorporating this evaluation into international scope, manganese, glutinate, promoting a comprehensive approach to improve patients' quality of life.
Short biography. Kaigusus Melikani, Department of Pulmonology, Mugla City Conman, University Institution, Quilopen and New Tab Mugla, Turkey. Tapan Oral Ojge, Department of Pulmonology, Mugla Smiti, Conman University The Institution, Quilopen and New Tab Mugla, Turkey. Tapan Utku, Department of Pulmonology, Mugla City Conman University The Institution, Quilopen and New Tab Mugla, Turkey. Gen Sebahata, Department of Pulmonology, Muglastiki, Conman University, the institution will open a new tab, Mugla, Turkey.
The objective of consultation with the article is emphasized on the importance of assessing balance and cognitive function that not only help identify deficit from the early stage of disease, but also guide the planning of personalized therapy strategies with pulmonary rehabilitation programs.
Synthesis of the document. The article evaluates the relationship between impaired balance and cognitive functions in patients under 65 years of age with chronic obstructive pulmonary disease, COPD. 60 patients with COPD and 60 early controls were included evaluating demographic data. Cognitive test, mini-mental test, balance, Berg balance scale, and depression, Beck depression scale. Patients with COPD were found to have worse results in test, especially two with severe dyspnea. The analysis showed that oxygen saturation is the main factor associated with balance. Cognitive and balance impairment in COPD may be due to hypoxia, chronic inflammation, muscle loss, and decreased physical activity. This alteration increased the risk of falls and hospitalization, negatively impacting the quality of life. Researchers recommend including early evaluations of balance and cognition in treatment protocols and prioritizing pulmonary rehabilitation to prevent functional deterioration. This study highlights the importance of a multidimensional approach in the management of COPD, considering both physical and cognitive aspects to improve the results and quality of lives of patients.
This article has expanded my understanding of the topic by offering a comprehensive analysis of the chronic obstructive pulmonary disease. Affects both cycle balance and cognitive functions in patients under the age of 65. Alex studied the moral this year before writing it had twofold considered how interactions between one cycle factors such as oxygen, saturation and severities of dyspnea, and cycle factors such depression and Static contributed to significant differences in patients' daily functioning. The study hangs how severe dyspnea and frequent hospitalization not only impact cycle capacities but as low conscious abilities.
What new perspective of ideas have you gained of the subject? We had gained new insights, for example, that patients with COP under years of age will have a dose balance and cognitive functions, which could lead to physical interventions that with physiotherapy can provide anti-speciality designated or age patient and setting to ensure that the damage is irreversible of at less control. It also mentioned that oxygen saturation plays an important role in cold and the deterioration of balance, which tells us therapy management is important.
How does this article relate to what you have learned in the module and your professional training in physical therapy? In relation to physiotherapy training, the article highlights important aspects for clinical practice, emphasizing the importance of assessing and addressing balance deficiencies in patients with COPD. One of the tools mentioned is the Berg Balance Scale, which allows for the identification of alterations in the stability of these patients who present a significantly higher risk of falls. This risk is related to factors such as muscle weakness, loss, or proprioception, and chronic fatigue, common conditions in those who suffer from this disease. COPD manifests itself as a disease with a multisystemic impact affecting not only respiratory function but also skeletal muscles and muscles coordination. These alterations are the result of the process such as systematic inflammation and chronic hypoxia with aggravated functional loss. Therefore, physiotherapy takes on an extremely important role, science through specific interventions such as strengthening, exercise, resistance training, and postural re-education techniques. It is possible to mitigate these limitations and contribute to comprehensive rehabilitation to improve the patient's quality of life. Furthermore, the article highlights the importance of performing early and systematic assessment of both balance and cognitive function. This assessment not only help to identify deficits from the early stage of the disease, but also guide to planning of personalized therapeutic strategies within pulmonary rehabilitation program. This allows not only to address the specific needs of each patient, but also to prevent the progression of associated functional disabilities, optimizing long-term results.
What implication does cognitive impairment have on the quality of life of patients with COPD, and how can it affect their adherence to treatment? 2. Soul balance assessments be part of
routine check-ups in patients with COPD. 3. How can health professionals integrate the assessment of cognitive and balance functionals in the treatment of patients with COPD to optimize their rehabilitation?
Good evening. Today I will present the key edit from the map of important balance and cognitive diffusion in patients with chronic obstruction pulmonary disease kept under 55 years of again introduction. Quality of life suffering keeps if significantly reduced due persistent breathlessness, cognitive decline have been linked to particularly in severe cause resolution. The control group have an average gain of 56.0353 years, similar to the group and similar education levels compassion with a significantly lower score balance. In conclusion, a comprehensive approach combining pulmonary rehabilitation with cognitive and psychological care is beneficial for quit patient improves over work and well-being. Thanks.